This is a presentation of the Canadian Injury Prevention Curriculum. Welcome to this module, Program and Policy Implementation for Injury Prevention Practitioners. This module will provide you with a basic understanding of how to plan the implementation of injury prevention interventions. Implementation is the fourth stage of the public health approach to injury prevention. However, laying the groundwork for implementation planning occurs throughout the entire process. The glossary found here contains terms and definitions that will be used throughout the module. If at any time during the module you would like a review of the terms definitions, this glossary can be accessed on the upper left tab in the toolbar. By the end of this module, you will have developed an implementation action plan. There are four main components of implementation, all of which we will take a closer look at later in the module. 1. A well-planned implementation strategy using an action plan. 2. Maintaining the fidelity of the evidence-based prevention strategy you are implementing. 3. Adapting the intervention for new populations and settings. And 4. Making sure there is an effort to measure and increase sustainability of your implemented program. Developing an implementation strategy is a non-linear process. Stages can be skipped and revisited at a later date. For example, a working group may be formed at the beginning and then updated with more knowledge users throughout the process. Unanticipated events may affect the success of your program. To map the process and supports needed, practitioners or researchers can develop an implementation action plan. A key element of the implementation strategy is defining and setting your plan. An action plan assists implementers to visually think about the necessary inputs that support the intervention, the core activities that are markers of success of the program, and the resulting outputs. It is important to consider the formative or pre-planning activities, the process or the success of the implementing core components of the program as they were intended, and the outcome or the effectiveness of the program outcome indicators. Example of an action plan. Actions and activities. What will we do and how will we do it? Your target group. Who are we trying to influence? Timeline and responsibilities. Who will do it and when will it be completed? Resources. What will we need to do it? And indicators. How will we know if we have done it? Your formative indicators for actions and activities is implementing a sport injury prevention program in youth soccer. Your indicator for your target group is youth recreation soccer players. Your formative indicator for timeline and responsibilities is discussions with the target population in year 1, engage coaches and parents in dialogue in year 1, and creative design companies develop promotional material in year 2. Your formative indicators for resources is funding for focus groups, promotional material development, and access to and assessment of existing capacity. Your formative indicators is establishing the need for the program, the fit of the program within the existing soccer program, and establishing the resources required and the capacity and readiness for change. Your process indicators in actions and activities and target group are the same. Implementing a sport injury prevention program in youth soccer, and your target group is youth recreation soccer players. Your process indicators for timelines and responsibilities is facilitators to run training workshops in year 1, and coaches to attend workshops and provide feedback in year 1. Your process indicators for resources is coaches' time, program facilitators' time, and funding for focus groups. Your process indicators is components that have been implemented, resources used to support implementation, and decisions to adopt the program. Your outcome indicators for timeline responsibilities is data collection, personnel for all established program outcomes in year 2. Your outcome indicators for resources are research assistants to collect ongoing data. And your outcome indicators are a reduction in injury in the training group. A key component to a successful implementation strategy is establishing who is part of the implementation team. Coordinating an implementation team and working groups should be one of the first activities when thinking about implementing a program or policy. This is the team that will develop the action plan. The implementation team should be made up of at least 3 partners who have expertise in A. the field of injury the program relates to, B. undertaking innovative program implementation, C. knowledge of implementation science/theory, and or D. use of the implementation in practice and or organizations and system changes. From our previous example of youth soccer, identify the partners and collective areas of expertise required for this implementation team. It is also a good idea to invite organizational supports to the team, such as A. a practitioner or individual with expertise in the injury of interest, B. management to lend leadership and knowledge on policy information, for example, liability, C. administration to assist with human resources and structural issues, D. representatives from a healthcare sector or other sector to play a lead role and discuss mandates related to the program, E. regional authority, provincial, community, federal, and national supports as they can advise on a variety of perspectives. A working group complements the implementation team and can consist of A. implementation team members, B. experts in the area of injury prevention, C. stakeholders, D. knowledge users, E. community members. Working groups provide valuable information, including constructive criticism, to inform and tailor the program. If you recall earlier in the module, I highlighted fidelity as a key component of implementation. Fidelity is essentially the degree to which a program is implemented, as intended by program developers. It identifies the necessary components of a program to ensure effectiveness, as identified in the literature. Another key component is adaptation. From an earlier stage in the public health, we learned that best strategy is to choose an existing evidence-based prevention strategy. Often, the strategy identified would have been implemented in a population other than the population you have. Therefore, it will need to be adapted. It is very important to document all the steps that were taken to adapt a program, such as the environment, staff, capacity and demands, resource available, the staff, equipment, materials, administrative process, the setting, and risk profile of the population. The last key component of implementation is sustainability. Factors that support and impede sustainability are important to think about as it provides practitioners with the necessary information to understand the context in which a program continues or does not continue after implementation efforts are complete. Here are a few tips to keep in your back pocket. 1. Determine specific dates for the program implementation. 2. Communicate clearly the program protocol in the event of gaps, challenges, and barriers during implementation. 3. Establish leadership engagement to sustain the program. 4. Schedule regular meetings, phone calls, or emails to maintain communication for ongoing feedback and opportunities for any changes to the implementation plan. 5. Monitor the implementation process to assess if the program should be continued or modified and any implications for update. To do so, consider the program's A. Perceived usefulness by all involved individuals, B. Time allocation, and C. Sustainability, both internally and externally, and what resources would be necessary. It is time to put your knowledge to the test. Think about an injury prevention program initiative you want to implement. Complete the components of the action plan. Once you are finished, you have the option to email the completed version to yourself and to colleagues, save it on your computer for a later date, or print off a copy for your records using the tools in the toolbar. Whatever you decide, press submit once you have finished. Here you will find some recommended resources and readings on implementation if you would like some further information. There are two parts to the module evaluation. The first is intended to assess if you have shifted your readiness to tackle program/policy implementation. It's comprised of two question groups. Each asks of how you felt at the start of the module, prior to the beginning, and how you feel now that you have completed the module. The final question of the self-evaluation is an exercise aimed at behavior change. The second part of the module evaluation is a feedback form, which helps us to improve the quality of the training and for developing future support around the workshops. Please click on the link below to complete the survey. Congratulations, you have completed this module. Here are all of the resources we use in the development of this module.